Shoulder dystocia. I'm sure many of you have been told that you experienced a shoulder dystocia with one of your deliveries. Or it's something that your doctor has put fear in your mind, telling you it's going to happen because you're expecting a big baby. So shoulder dystocia is a complication of vaginal birth. And what I've seen so often is that in the mainstream medical system, this will be a tool of fear-mongering to scare a woman about having a vaginal birth. And I hate to say that, but that's the simple facts of the matter. As an out-of-hospital midwife, we are trained, at least I was, as a student, how to handle shoulder dystocias, and we would drill on this for hours and hours in workshops to learn how to handle shoulder dystocia with a doll and a pelvis. But that teaches you muscle memory of actual maneuvers to help resolve a shoulder dystocia. So some women have come to me for care because their previous delivery in the hospital, they were told, you had a shoulder dystocia, so next time we need to have a C-section. And so the problem with this is that when I really ask more questions and find out what actually happened, I'm like, that was not a shoulder dystocia at all. So first off, in the mainstream medical system, they don't understand nor respect true natural physiological birth. So in their minds, if the baby's head delivers and then the rest of the body doesn't immediately come out, they call that a dystocia. That's not a dystocia. What that is a natural physiological step. So in a normal natural birth, a baby's head will deliver, and then the progression may pause as the woman and the baby are having a break in between contractions. And with the next contraction, then the baby rotates their shoulders so they can come down and come out less traumatically for the mother's vaginal tissues. And that 2 to 3 minutes in between contractions is actually really good physiologically for the baby. Now, there are specific signs that a skilled provider are watching for during those 2 minutes to know and understand, is this going to be a dystocia, or are we just waiting for the next contraction? And so there have been times that I know before the next contraction that I'm going to have to get my hands on and help that baby out. But most of the time, that's not the case at all. It's just the body and the baby are waiting for the next contraction. Then baby does the rotation and then they come on down. This is very normal. And that 2 to 3 minutes when the baby is paused there, hanging out, that's not a dystocia at all. It's actually very good for the baby to actually get that good chest squeeze to really help squeeze their, it's like when the baby comes through the birth canal and they're there getting that little bit of a squeeze, waiting for that next contraction, it's actually good for their bodies. It's good for their lungs. And when they come out, then they're ready to take that big, deep breath. And their bodies are processing this big transition in a really natural and healthy way that's good for them. And it's more gentle on the mother's vaginal tissues. So, that's not a dystocia. A dystocia is when the baby's head comes down and then the next contraction comes and they're not making progress. Then you might have to get involved and you might actually have to help disengage the baby and then rotate the baby and then help the baby down. And the number one thing that we do out of hospital is, first off, we're educating the woman throughout her whole pregnancy, preparing her for a natural birth. And the very first prevention of shoulder dystocia is allow labor to happen spontaneously when the woman's body and the baby are ready for this big process. And so when we wait for that process to initiate on its own, so no inductions, then the process goes much more smooth. The baby is usually in a more optimal position to navigate the pelvis. When we're allowing the woman to listen to her body throughout the labor process, this is the second thing. We're allowing the woman to listen to her body through the process, and she and her baby are working together. It's like this beautiful dance that the mom and the baby are doing together. If the woman is in tune with her body and working with it to help her labor process, and this is doing things like maybe being upright, moving around, maybe sitting on the toilet, maybe taking a shower, maybe relaxing in the birth pool, maybe laying in bed, maybe a combination of all of these things, which is usually what we recommend, because constantly moving, not constantly, but moving and changing positions often is really important in the labor process. And so that helps with the woman staying more comfortable and able to manage the waves that she's experiencing as her body's opening to move her baby down. And so this is the second thing. It's letting the body and the baby work together, maybe doing position changes to help that process. The third thing is no forced pushing. When we are force pushing, then we are maybe compacting that baby down into the pelvis in a way that they're not going to be able to easily navigate that pelvis. And so the longer I do this work, the more I have been teaching women, avoid pushing with everything you can. When we are force pushing the way women have been taught for decades and decades, we are causing more trauma to our babies and our bodies, and it's not really helpful. And so I've gotten such good outcomes by teaching women, just stay relaxed, stay calm, let your body move the baby down. And we don't have to force push. Eventually, your body, if it can dilate and open, it can get your baby out. You might have to do some different position changes. But when we force push, we are actually maybe compacting baby down in not a great way. And so let's just let this beautiful natural process do its work and move that baby down in a way that is more gentle on baby and helps that baby navigate the pelvis. You have to remember the baby is an active participant in this process. They need to be alert and able to do what they need to do physically to navigate the pelvis. And so their movements are instinctual, but if we're forcing things on our end, it makes it harder for the baby to do their part. And so when we slow that part down and we let the woman's tissue open slowly, it actually avoids things like tearing and dystocias. So the concern about shoulder dystocia is, for the most part, pretty unfounded. I've managed some very severe dystocias, and it's very rarely a very large baby. Now, I will say the largest baby that I ever helped deliver was when I was still a primary student under the supervision of another midwife. That baby did have a dystocia and was stuck in the pelvis for, 6 to 8 minutes. We did eventually get that baby out unharmed, because midwives know how to get the baby out without harming them. But that baby was too big to navigate that birth canal, because that woman should have been risked out of home birth months before, but that's a whole different story. Since I've been running my own practice, I've never had a huge baby that got stuck, because I'm making sure that my women don't have gestational diabetes. When a woman has gestational diabetes, that is the one time that if her blood sugars are highly uncontrolled and her numbers are very high most of the time, or her fastings are very high every day, she's at risk of a shoulder dystocia. Outside of that, I truly do not believe a body can grow a baby that's too big for it to birth. again, with healthy women who do not have gestational diabetes. And so another thing, I just thought of one more thing I wanted to mention about the delivery itself. If a baby does get stuck and we have an actual shoulder dystocia, the worst thing that you could possibly do is start tugging and pulling on that baby's head. That is going to cause nerve damage and hurt that baby's spinal cord potentially. What is needed is disimpact the shoulders off of the pubic bone and help that baby rotate. I never see that maneuver done in a hospital. And I never see because of epidural. Most of the women have epidurals. But the number one way to help a baby get unstuck out of a pelvis who is truly stuck is to have the mom change positions. So if she's on her back, we flip her over on hands and knees. If that doesn't work, we'll have the woman get into a running pose. If that doesn't work, we alternate legs, go to the other running pose. And then we'll just rotate through multiple different positions to help change the pelvic opening outlet, change the diameter and the size and the shape with different position changes. Unfortunately, women who have epidurals, which are the majority in the hospital, they can't do this. They can't change positions. This is why I tell women all the time, if you have a shoulder dystocia, you are safer outside of the hospital with a skilled, experienced midwife than you are in the hospital under epidural anesthesia, because you can't fully help your baby exit the pelvis if they truly are stuck when you're just stuck on your back. Just going from being on your back or in that reclined position that they typically have women in the hospital, flipping over and getting on knees opens the pelvic outlet by 50% more. And so I'm not afraid of shoulder dystocia because outside of that one big baby I just mentioned, I've delivered 11, almost 12-pound babies that just slide out like butter. And my hardest dystocias were 7-pound babies, 7.5-pound babies, because a lot of times those mothers had done something. Noticing I have a gray hair sticking up. That's embarrassing. But a lot of times those 7.5-pound babies that get stuck are because the mothers became impatient. They did something to force hard contractions. A lot of times when I've seen this, it's a woman has done something like taking castor oil or really hard herbs against my advice because they're just tired of being pregnant. And then they get into a really hard, fast labor scenario, and their 7.5-pound baby comes down in a really funky way into the pelvis, and they get stuck and they need help to get out and that's just because someone got impatient, forced a process by causing unnatural contractions. And so this is why I don't like messing with the process. Even the things that we have outside of the hospital that can help cause labor, if your baby's not in an ideal position, and that can happen even if you go into spontaneous labor, but we reduce the chances when your body goes into spontaneous labor without a nudge or something forcing them. So what else do I want to say about shoulder dystocia? If anyone has any questions about shoulder dystocia that I have not addressed here, please ask the question in the comments below. And I'll answer that, or I might do another video if there's multiple other questions about shoulder dystocia. But the biggest thing I want you to know is don't be afraid of a shoulder dystocia. We can get those babies out. We don't love them. But the fact that so many women are being scared into getting a C-section because they're being told your baby's big and they might get stuck and they have great blood sugar numbers, that's a bunch of nonsense. That's statistically that doesn't happen. Maybe it does in the hospital. I don't know, but it doesn't happen with me or the other midwives I know and respect. We don't have those problems. So anyway, sorry. I get on here to talk about one little thing and I take 15 minutes because yeah, whatever. I appreciate y'all being here. I want to be helpful. I want to answer questions for you guys. If you have any other questions about children's dystocia, please comment below and I will answer them for you. And I'll be back in a few days with another topic. Thanks, guys. Have a great day.